Hello everyone, this is Dr. Miranda and welcome back to my YouTube channel, Dr. Vlogger. So for today, I'm going to react to this channel, Med School Insiders, dun sa topic nila na So You Want to Be an Internal Medicine Doctor, episode 19. Start tayo!
Be an internal medicine doctor. You like the idea of being a generalist, knowing the interplay of each organ system, and the mental exercise of deeply thinking about your patients for hours on end while rounding. Let's debunk the public perception myths and give it to you straight. This is the reality of internal medicine.
So yeah, generalist. He used the word generalist. Well, acceptable. We are dealing with a lot of organ systems. Imagine mo hypertension, diabetes, asthma, pneumonia, UTI. So a lot of organ systems are involved.
When you think of a doctor, it's very likely that the picture you conjure up in your mind is that of an internal medicine physician or internist.
He has a point. Especially pag medyo bata ka and you have no idea of all these specializations and then you just say na gusto ko mag-doctor, you're envisioning naman talaga of an internist na nagagamot ng hypertension, diabetes, yung sa clinic, may desk, may stethoscope, nag-interview ng patient, nag-examine, di ba? Parang yun naman talaga iniisip mo that that is like the idea la, ganyan yung doktor. And then as you go on, nag-med school ka, nag-pre-med ka, med school ka, you realize there are a lot of specialties, subspecialties, and yun, dun mo nalalaman na lang din na hindi lang pala internist or internal medicine ang specialization.
Is the specialty that deals with the diagnosis, treatment, and prevention of a broad and extensive number of diseases that affect adult patients.
Yes, the prevention, the diagnosis, the treatment. Sinabi ko naman din yun sa previous video ko.
Think real-life Dr. House.
In fairness, I love Dr. House. Siya nga yung naisip ko.
Those that choose internal medicine are stereotypically the inquisitive and thoughtful ones who love learning, want to be heavily involved with direct patient care, and enjoy the challenge of analyzing broad information to figure out the puzzle to help their patients get back.
Correct. Ang totoo din naman because as internist, you interview a patient, you examine them, and then talagang kinakalkal mo yung mga pinag-aralan mo, and then you go back to the book as well. You also read, especially pag hindi talaga ganun kadali or complicated or complex yung case na nasa harap mo. It's a non-stop learning as well.
The stereotype of internal medicine physicians is that they sit around hours on end thinking about how to micromanage each of their patients' conditions without ever using their hand.
I agree. Sabi nga nila, we're not good with our hands daw. But then again, it's okay kasi paano magpo-function yung hands if you're not even using your brain? In our specialization talaga, you really have to think and you also have to correlate everything. Yun ang sabi nila na parang nasa clinic lang, ganun-ganun. But it's not true, ha? There are a lot of us who do procedures. We intubate patients. There are others who do thoracentesis or yung mga ibang mga procedures, may iba nag-IJ cath, maraming procedures naman ginagawa ang internist sa.
This is partially true. Internal medicine is much more of an intellectual specialty.
Well, that I agree. Intellectual specialty talaga siya.
There are a few ways to categorize the specialty. Outpatient internal medicine doctors work exclusively in the clinic or outpatient setting, where patients schedule an appointment, have a brief 15-minute visit, and head back home.
Okay, so he's saying outpatient versus inpatient. Before anything else pala, this is like a setting yata sa US or sa Canada, but of course sa atin, true, may outpatient and inpatient, clinics ang sinasabi dun sa outpatient, pero medyo hindi ako nag-agree dun sa brief 15-minute visit. Based on experience, minsan hindi naman talaga, hindi mo naorasan yung patient-doctor interaction pala at clinics kasi it will depend on the patient's condition na hindi lang kailangan ng 15 minutes and usually talaga sa Filipino settings, marami silang tanong, marami silang gustong malaman, so hindi lang siya 15 minutes. And those are outpatient, yung sa mga clinics na. And sa inpatient, totoo din naman, we can relate because we admit patients as well, especially pag outpatient na admissible sila or galing sa ER.
With inpatient, on the other hand, you'll be treating patients who are admitted, meaning they are staying in the hospital for several days. They are usually sicker patients than what you'll see in the outpatient setting, often including acute conditions or exacerbations of chronic conditions.
Dun sa inpatient na sinasabi nila dito, ito na din yata yung mga hospitalist nila doon. And we also have this here, like what I've said, I also work as hospitalist. I can have clinics, but I also work as an internal medicine junior consultant. Inpatient nga, like what he is saying, sa mga acute conditions or sa mga exacerbation of chronic conditions, yun yung mga sicker patients nga naman, we tend to those patient na kailangan i-admit. And pwede din yun. So there are a lot of opportunities na pwede mong gawin as an internist. Pwede kang clinics, pwede kang hospitalists.
Physicians who practice in an academic setting are involved not only in patient care, but also teaching the next generation of physicians, meaning medical students and residents.
May mga friends ako that do this. They've become professors. They have become teachers, especially in Cebu. I have close friends that are teaching medical students. Nakakatuwa lang kasi pag pinag-usapan namin parang, oo nga, noon kami yung students, ngayon sila na yung teachers, especially nung nag-pandemic. Medyo madami sa kanila ang naging teachers. Iba talaga din kasi ang fulfillment of the academic side of being a physician.
There are also usually requirements with regards to research, and most faculty are involved in some number of projects at any given time.
Yes. Just like when nag-residency training ako, syempre, yung mga consultants namin, some of them are already internists and subspecialists na din, but they taught us or they helped us with our research and with our, yun nga, yung may journal to be published. Hihira lang din naman sa mga consultants ang may talent and my time and my patience sa academic setting.
The third and least common option is to pursue private practice, where you'll be your own.
The private practice, we do that here, of course. Majority naman of us do that. I think sa US pa sinasabi nila kasi the third and least common. Least common daw siya doon. Kasi medyo common yata talaga sa kanila yung hospitalist. Different way lang of how to start your practice. Some of us buy stocks para makapag-practice dun sa specific hospital. Some of us buy or rent a space or a separate na parang clinic siya talaga. Kanya-kanya lang. So, common sa atin dito yung private practices.
You'll be rotating through the wards, ICU, and various subspecialty electives where you will help admit, manage, and discharge patients.
Sa atin naman, of course, yeah, we rotate sa wards. Usually, dun sa time ko ha, wards sa first year, second year is may ER ka na and then subspecialties like sa gastro, cardio, nephro, sa dialysis, and pag third year ka na, ICU na din. And then, of course, you will have the chief residency opportunity if tatanggapin mo din, if i-offer din sa'yo.
Internal medicine is considered the default, largest specialty, and medical students who apply here stereotypically are the ones who couldn't decide on a specialty.
That isn't fair. Well, pwede. Kasi ako, I was really sure na mag-internal medicine because of my experience sa Asian Hospital as a junior house staff. Din ko na-realize na I want to handle adult patients, especially yung mga tao na, yung mga patients na nasa ICU.
The flexibility of internal medicine is attractive, as you have a variety of options in practice setting, in addition to the widest variety of specialties to choose from through fellowship. After a couple years of residency, you're in a position to make another decision. Do you want to go out and practice after general IM, or subspecialize into cardiology, gastroenterology, immunology, or something else?
As of now, I'm thinking in going to cardiology fellowship, but I'm still not sure kasi may mga kids na ako and I have family. Hindi ko may imagine na naman yung sarili kong mag-training and less yung time with them, so tingnan na lang natin.
And love the intellectual aspects of medicine. They're the ones who enjoy complex puzzles, taking in vast quantities of information through history, physical exam, and various labs and imaging.
Yan ang gusto ko sa internal medicine. Talagang mag-iisip ka. Based sa history, physical examination, and laboratory, isipin mo na lahat ng differential diagnosis and then yung primary impression, admitting diagnosis, kung ano ba talaga yung iniisip mo regarding that patient with what his history and PE, tapos yung lab test may correlate mo, and then i-follow up mo pa days and titingnan mo, and then ma-confirm mo yung initial diagnosis mo or even one of your differential diagnosis. Nakaka-fulfill siya. The achievement na you're able to diagnose and treat them, and then you're able to discharge the patients.
After completing 3 years of internal medicine residency, you can choose to specialize with fellowship. Cardiovascular disease, also called cardiology, is a 3-year fellowship focusing on diseases relating to the heart.
That's what I want na subspecialty, cardiology.
After cardiology fellowship, you can specialize further with advanced heart failure, interventional cardiology, electrophysiology, and others. You can learn more.
Yes, ayun pa. Pag after cardiology, of course, you still want to be more. May ganun eh. Hindi talaga, it doesn't end there na cardiologist ka na. You can opt to become interventional cardiologist. May ibang nagtutud echo. May ibang yun nga advanced heart failure, electrophysiologist. Ang dami. May cardiac rehab pa.
As a hospitalist, the most common model is 7 on, 7 off. But it's not uncommon to have 2 weeks on and 2 off, meaning you work for 14 days straight, followed by 2 weeks off.
Well, medyo different yan, but totoo din naman work-life balance because in our country, we can decide when to go on duty, like MWF, or pwedeng Monday, Tuesday, Wednesday, or pwedeng 5 days straight. It's true, may ibang nagto 2 weeks naman, but personally, dahil nga may family ako, I don't do that. I only do talaga 1 day duty, and then minsan sinisingit ko yung clinics ko. And as of now, by appointment na lang din, and usually online consults na lang as of this time.
As an internist, you'll always have patients to see.
Yes, very on point. Kasi lahat naman, may high blood, may diabetes, may mga concerns sa body nila na kahit as simple as masakit ang ulo, masakit ang katawan, di ba? Internist naman din lagi, usually muna, kasi kami yung pinakauna, and then i-refer na lang namin sa specialists.
Internal medicine is one of the few specialties where you continue to develop that broad knowledge. Many other specialties narrow down and dive deep at the expense of most other things you learned in medical school. There's an inherent satisfaction in knowing you're able to manage most anything that walks through the door to some extent.
Totoo. It's one of the things that I love being an internist and that I don't want to let go of if I eventually go to fellowship. Kasi para ang dami mong alam when you're an internist, ang dami mong pwedeng i-tackle or i-treat, i-manage, ang daming, although the responsibility is great, that's why you're obliged to really read and update yourself sa mga CPGs na ganito, ng ganyan, na marami, hypertension, diabetes, asthma, lahat, pneumonia, UTI. Pero because of that, because you are obliged to read more, ang dami mong alam, ang dami mong manage. You're a doctor, especially if you love being a doctor, you really have to learn. You really love learning. You have to have that passion for knowledge.
You must love learning, as this is a complex field with many moving parts.
Learning.
A great deal of research continuously updating and improving various therapies and modern medicine's understanding of disease. While all doctors must be lifelong learners to be at the top of their craft, internal medicine doctors must do so at another level.
So that's it. That's my reaction to that video. First time ko naman siya napanood. Medyo nakaka-relate naman tayo sa majority of what he said. Some of those what he said kasi sa American setting or Canada yata to. I disagree with most na pag hindi ka makadecide mag-internal medicine ka because apparently pag nasa IM ka na and nasa first year ka na and then you'll realize na hindi talaga yung para sa'yo yung IM, you're going to quit. I assure you that you're going to quit. Kasi kahit anong mo dyan, kung pumunta ka first year, hindi ka maglalast dyan if you're not decided to be an internist. That's just a piece of my mind, and that's it, guys. So I hope you enjoyed today's video, and don't forget to like and subscribe and share this video and click on that notification bell to be updated with my latest uploads. And I will make shoutouts of the day because I kept on forgetting making shoutouts of the day. We have Evangeline Aragon. Thank you for always commenting on my videos. Miss Evangeline Aragon. Hi Doc, have a blessed New Year. Goodbye 2020 and welcome 2021. Wala nang sakit ang mundo at maging normal lahat tayo. Makamove on na. God bless everyone. I agree with you, Ma'am Aragon. And also, Tina Salazar. Happy New Year, Doc and fam. Mabuhay po kayo, our frontliner heroes. Salupot. Thank you so much. Happy New Year din. And for Odeline Kaduya, Happy New Year, Doc. God bless you more and more this 2021. Ingat po palagi. Yes, ingat po tayo lagi. Also to Maria Cordero, Happy New Year din po sa inyo. And that's all for my shoutouts of the day. And see you in my next video. Bye-bye.